Hey guys, welcome back to my channel, or welcome if you're new here. Today we are going to talk about the most important things for you to know as a nurse in order to care for a client with an ostomy or to answer test questions about an ostomy. So if that sounds interesting to you, stay tuned. Okay guys, so let's dive into the most important things that you need to know as a nurse to care for a client with an ostomy. So an ostomy itself is a surgical opening from the inside of the body to the outside of the body. It can be permanent, it can be temporary. Temporary meaning that at some point in the future, it could be months, it could be a year, it could be longer. The client's abdomen will be reopened surgically and the intestines will be reanastomosed. Now, the stoma itself, which is what you see in this picture, that is the actual artificial opening that is created by the ostomy procedure. And it should always be a pinkish red color, and it should always be moist. Now, it is normal for it to protrude from the abdominal wall anywhere from 1 to 3 inches. And then the skin needs to be assessed around the stoma. It should be smooth and intact and not red or excoriated. And we're going to talk in a few minutes about how we protect that skin around the stoma. Now, if your stoma is pale or purple or dry, that's a perfusion problem. So again, perfusion, blood, that's oxygen. When we don't have oxygen or good blood flow to an area of the body, we get ischemia. So pale, purple, or dry stoma, that would equal perfusion issue, ischemia. Now, we can have two types of ostomies. An ileostomy is going to be a surgical opening in the ileum to drain stool. Now, the ileum is part of the small intestine. It's found in this corner of the abdomen, and the stool is going to be very liquid and frequent because we are bypassing the large intestine. So the ileum is the part of the small intestine, the last part, which actually connects to the first part of the large intestine, which is the cecum. So by having an ileostomy, you're bypassing the colon, and stool is going to drain directly out of that lower part of the small intestine. So liquid and frequent. A colostomy is a surgical opening in the large intestine, and the characteristics of the stool are going to depend on where that ostomy is located. So in the ascending colon, we are still going to see stool that is very liquid. As we move into the transverse colon, that stool will be still semi-solid, semi-liquid, but more formed. And then as we move into the descending colon, stool is going to be even more normal looking, more formed. And by the time we get to the sigmoid colon, that is near normal stool. This is important information to know, especially for testing purposes. Now, when we think about ostomies, we have to talk about appliances. Now, appliances can come, as you see in the picture on the right, a bag and a wafer already attached together. And what you see on the left is a bag and a wafer as two separate pieces and parts. And again, that's just preference of the facility, preference of the insurance company that's sending the pouches to the client. It might even be client preference, but we will see two different types. Either way, the way we're going to apply this ostomy appliance is exactly the same. Now, the first thing that we have to think about is the size of the opening of the wafer. So the wafer is what is actually going to go over the stoma and attach to the skin. Now, this opening is going to come very, very small, and we need to enlarge it to fit the stoma. So that opening needs to be about 1/8 to 1/16 of an inch larger than the stoma. Now, your packaging will also come with a measuring tool typically, or you'll have a measuring tool that is either on your unit or was provided to the patient so that they can actually place it over the stoma, determine exactly the amount that needs to be cut. Then that tool can be placed over the wafer, and you're going to see this in a video in just a minute, and then you can cut around the opening of the wafer to make sure that it fits over the stoma. Now, once we have our opening cut to the appropriate size, we do want to apply a skin barrier or a skin protectant around that stoma. So that can be just any kind of skin barrier or skin protectant. There are some that are manufactured specifically for or by companies that produce ostomy appliances, but anything that you have available in your facility as a skin protectant should work. Now, we want to let that dry before we then get ready to apply our adhesive paste. So adhesive paste, again, you're going to see this in the video, gets applied all around the stoma. And then we do want to attach that wafer directly over the paste, which is adhesive on the back, but the paste just helps it stick a little bit better. So it's a more solid seal. Now, the other thing that you may want to do is have the client just place their hand over that wafer and that bag. The heat from the hand, the heat from the body just helps to further seal that adhesive down so that you're, again, getting that more stable, solid adhesion. Now, we also want to teach clients to empty these bags when they are 1/3 to 1/2 full of stool. The heavier it gets, the more possibility that you could have disruption of the adhesive seal. You could have leakage. Clients never want to deal with that. So when it's about 1/3 to 1/2 full, and then some of these patches come with a filter that's embedded in the bag. There are also deodorizers, commercial deodorizers that are made specifically to put in the pouches. You might also read about teaching clients to put a breath mint in the pouch. That all helps to control odor. And that usually is a big concern that clients have, is the odor coming from this pouch. Now, we also want to teach the client to monitor for leakage. Now, you can have leakage at the bottom of the pouch. So pouches close in a couple of different ways, but you want to make sure that it is securely closed so that you aren't getting any leakage from the bottom. Now, you could also have leakage from the top around the wafer because your seal is not solid or effective. And we want to teach clients, of course, to monitor for that if they are having leakage, to try to troubleshoot the problem. Okay, let's see a stoma and watch stoma care.
Gently push the skin away to remove the skin barrier and the used pouch. If necessary, use an adhesive remover.
Doing okay? Okay. Still doing okay? Okay.
I am.
I'm going to take this to the bathroom real quick, and I'll be right back.
Empty solid waste into the toilet. If waste is liquid, measure it before disposal. Discard the old pouch in a waterproof bag.
Okay. So we'll clean the area with a little warm water, and then we'll put the new ostomy bag on.
Okay.
I'll show you how we measure it and cut it, and that way you'll know how to do it when you do it yourself.
Okay.
Wash the skin around the stoma gently with a washcloth and warm tap water. If you touch the stoma, it may bleed a little. That's normal. Pat the skin dry.
They'll come with these little tools that have different sizes.
Okay.
And then you just kind of eyeball which one is the best.
Next, measure its diameter.
You don't want it too big or too small either.
Then trace the shape of the stoma on the pouch backing or skin barrier wafer. Cut an opening that's at least 1/8 of an inch larger than the stoma to avoid putting pressure on it.
And this is called stoma paste. We'll put it around the outside of the stoma. It just kind of gives it an extra seal.
Okay.
Stoma paste may be applied around the stoma to help the pouch stick and prevent skin irritation.
Just peel the backing off.
Okay.
Remove the protective backing from the adhesive. Center the pouch over the stoma and press it firmly into place. Have the patient hold her hand over the pouch. Her body heat will help secure the seal.
I'm going to have you put your hand on there to kind of melt it, so it kind of warms it and melts it down so it sticks good. And then we just...
Now close the pouch. If you are using a clip-type pouch, do not forget to apply the clip. Remove the patient's drape and help her into a comfortable position.
Okay, see if we got it all on there.
Then remove your gloves. Perform hand hygiene.
Okay, let's move on to some client education. So often food or nutrition, foods that we should eat, foods that we shouldn't eat, are a big part of ostomy education. So I want to really talk today about foods that are really the most concerning to clients. Those are those that cause odor. There are foods that will cause odor, and there are foods that will decrease odor. So let's talk about some of that. Now, the odor is coming from gas, so we'll also talk about foods that cause gas and foods that decrease gas. So stool is always going to be more odorous if the client is eating fish, eggs, asparagus, garlic, any kind of legume or bean, and then of course those dark green leafy vegetables. However, there are foods foods that will help decrease odor in the stool: buttermilk, cranberry juice, parsley, yogurt. Those are all good things to help decrease odor. Now, there are foods, of course, that cause gas. So again, those green leafy vegetables, any carbonated beverages, dairy, corn, chewing gum, skipping meals, smoking also increases gas. Yogurt, crackers, and toast will decrease gas. So these are often really important things that clients want to know and understand. Now, we also want to teach clients to avoid very high fiber foods for the first couple of months. We don't want to get a blockage through that stoma, and we want to increase fluid intake. Now, once the stoma has healed, clients should really be careful with hard foods, so nuts, dried fruits, anything that's very hard or sticky, but for the most part can eat anything that they want. That stoma has healed and they've been cleared. Okay, so let's look at some practice questions. Now remember, if you need more time to read over the answer options, you can always pause the video. First question: Sheila's bowel resection resulted in a transverse colostomy. She asked the nurse what the stool will look like once she begins to eat. Which answer by the nurse is accurate? And so the answer to this question is semi-formed stools. This is the transverse colon. Now we know that we will see semi-liquid stools in the ascending colon. Now the very, very liquid stools will come from the ileostomy. Semi-formed would be transverse, but much more formed, very close to normal, from the descending colon. And then by the time we hit the sigmoid colon, which is the last portion of the colon, almost identical to normal stools. A nurse is completing discharge teaching with a client who is 3 days postoperative following a transverse colostomy. Which should the nurse include in the teaching? And the answer to this question is going to be the stoma should be pink and moist. Let's look at the incorrect answer options. So mucus will only be present for 2 or 3 days. So just for a couple of days from that stoma after surgery, or in the stool after surgery, not for up to a week. We will within days have stool from that stoma. So not 2 weeks, but within just a few days, we will start to see that semi-formed stool, because remember, this is the transverse colon. And then changing the stoma bag. It should be emptied when 1/2 to 3/4 full. Last question. At the beginning of the shift, the nurse is assigned a client with an ascending colostomy. Which picture identifies the correct placement where the nurse will assess the stoma? And so the correct answer to this question is number 4, right? So here is our ascending colon. This is our transverse colon, so that would be picture number 3. Right, our descending colon is picture number 2. And then, of course, our sigmoid colon is down here. Okay, so that's all I have for you today related to ostomy care. If you have any questions, don't forget to leave them down in a comment box below, or you can reach out to me via email as well. I'm also posting daily over on Twitter and Instagram, and currently I'm in the middle of an NCLEX series where we are talking all about how to study for NCLEX and exactly what NCLEX tests on. So if that's something that you find interesting, head over there and check out those posts. Have a wonderful day, and I will see you in the next video.